How do we decide the right dose of medication? In medicine, getting the dose right is crucial. Too little won't work, too much can be toxic. This is where pharmacokinetics helps, which is sometimes described as what the body does to a drug, so it's referring to the movement of drug into, through, and out of the body, so in other words, the time course of its absorption, bioavailability, distribution, metabolism, and excretion. So pharmacokinetics helps us understand what a drug's half-life. It is the time it takes for its concentration in the blood to reduce by half. For example, if a drug starts at 100 mg per liter and has a half-life of 5 hours, it will drop to 50 mg per liter after 5 hours, then 25 mg per liter after 10 hours, and so on, as seen on the graph. To quickly reach an effective level, doctors use a loading dose, a higher initial dose, followed by smaller maintenance doses to keep drug levels steady. Let's look at paracetamol. With a short half-life of 2 to 3 hours, it's cleared quickly, so it needs dosing every 4 to 6 hours. Skipping doses lets levels fall below the therapeutic range, and taking too much risks serious liver damage. In other words, a short half-life equals frequent dosing. Now, digoxin, it has a long half-life, around 36 to 48 hours, and a narrow therapeutic index. It's dosed once daily, but because it builds up slowly, a loading dose may be needed. Toxic levels can develop if the kidneys aren't clearing it well, so regular monitoring is essential. So a long half-life equals less frequent dosing, but higher risk of toxicity. The following graphs show that after 5 half-lives, a drug like digoxin reaches steady state. Without a loading dose, this can take days. After stopping, it takes another 5 half-lives to eliminate most of the drug. In emergencies, morphine, short half-life, is ideal for rapid pain relief, needing frequent doses. Methadone, long half-life, offers stable, once-daily dosing for chronic pain and opioid use disorder. Key pharmacokinetic concepts. Short half-life equals flexibility, quick adjustments. Long half-life equals stability, but slower response and risk of accumulation. Finally, in renal or liver impairment, drug clearance slows. Half-life prolongs, drug levels rise, and toxicity risks increase. For kidney issues, dosing may need to be reduced, spaced out, or carefully monitored, especially with drugs like digoxin, gentamicin, or metformin. Understanding half-life isn't just academic, it's critical for safe, effective patient care.